Maybe.
Yeah, I know. What do you think?
I don't mean to be
No,
condescending, but you know what I mean? That's why I started getting involved with it. You know, because, you know, do I still do Western medicine? Yeah, I just saved the cat's life. But you know what I mean?
Oh, is that man?
Yes. So, you know, there's a place for it. There's no question.
Mm-hmm.
With emergencies, with acute illness, no question. With chronic disease, it doesn't work very well. You know, and it's, you know, we just keep putting Band-Aids on things, and we rarely dare deal, you know, we're dealing with on the molecular level, and we're not stepping back and looking at the whole patient. So yeah, I mean, that's why I do integrative medicine, because I look at a patient and say, what is best for this dog? If I looked at this dog and I thought using a steroid would be the best thing, that's what I'm going to use. If I found the antibiotic was appropriate, that's what I'd use. You understand?
I do.
So,
I do.
so that's the power of integration.
I researched you so much. That's why I was so anxious to get here today, and that's why I sort of reached out to you with that email.
Sure.
I was shocked when you answered back.
Why is that?
Sarah Noble's the only other one that ever, and well, Dr. Pletchner, but I mean, you know, ones that I deal with on a frequent basis, and I had never actually dealt with you, and yeah, you answered, and I was like, oh my God.
How you doing, baby?
Tanya down there, Tanya's one of my favorites, and she talks so highly of you.
Tanya is a hoot.
Yeah, you treat her dog.
Yeah. Tanya is a hoot.
Will the fur on her knees grow back?
The answer is I don't know, especially with her being on the steroid.
Oh, gotcha.
And that's probably why it's slow to grow back.
Yeah, and her arm too, where she had the IV, it's growing back on her head a little, where they did. As a human, I'm so used to putting, you know, a patient, well, the doctor putting the patient in a pretzel position and withdrawing the spinal fluid from the lumbar region.
Yep.
So when she came out with that reverse mohawk stripe on her head, I'm like, what the heck is that? It's okay, baby. Mama's right here. Yes. Mama's right here, honey.
All right, sweetie. I'm going to do a couple more points, not too many.
Mama's right here.
Good.
Oh my goodness. I thought that was the volume.
All right, I think that is a good start. We're not going to do too much with you. And again, you know, we could do herbs, we could do all kinds of things. I want to see her response to what we're doing. I'm not a one to do 10 things at once.
Okay.
Because it just muddles the picture and we don't know.
Well, honestly, if I'm going to be totally honest with you, because I just get this feeling that I can trust you and you're not going to run and tell other people, I just feel like everybody's trying all these modalities out on her in such a short period of time that it's almost overwhelming.
Yep.
And I can't tell if one thing is working
Right.
or not.
Right.
I can say, despite what Dr. Putoff said, that the stem cell, I saw slow but steady and consistent improvement.
Right.
You know what? I had knee replacements. Prior to my knee replacements, if doctor took my leg and twisted it, you better believe I'd be open. So I don't think that was a good test to see if the stem cell worked.
Yep.
Hey, baby. Is this sort of based on like, well, I don't know, it's like, I don't know which happened first, but is this sort of based, I had a TENS unit for my back.
Yeah, this is different.
Oh, okay.
You know, a TENS unit, you're really cranking up the power. You're trying to change the muscle fibers, the actin and myosin fibers, from being stuck together. So all we're trying to do here, this is a very gentle. This is a very gentle pulse, and it's varying between fast, boom, 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 and slow.
Oh, okay.
And it goes back and forth. So all we're trying to do is get blood flow moving through here. We're not trying to fatigue muscle. We're not trying to like overpower. Basically, that's what a TENS does. It's like overpowering the diseased muscle. This is very gentle. It's just about trying to...
I stopped using it and started doing specific like core strengthening exercises, and that helped my problem more than that TENS unit.
So one of the things we will consider with this dog is moxa. You're doing it at home, but we'll talk about that.
Moxa?
Moxa is a herb that you heat,
Oh, okay.
and it helps bring blood flow.
Do you put it on them, or they eat it?
No, you right above the tissue.
Oh.
And I'm actually in the process of trying to get a way of doing it that's safer. The problem is the moxa is really hot, and if you're not really careful, you can easily burn them.
Oh, okay.
So I just saw this device that you can put it in, and it protects them, so there's no chance of burning them.
Oh.
So I'm trying to figure out how I can do that for animals.
What about the golden paste with the turmeric?
The turmeric's fine. I mean, it's what we call a blood mover in Chinese medicine.
Yeah, it's a veterinarian that
Yeah. So
come
turmeric
up with all this.
turmeric is fine.
But in the golden paste with the coconut oil and all
Fine.
that. Okay,
Absolutely fine.
I'll make it then. I had
Yeah.
stopped it just
Yeah.
because.
Yeah.
I mean, that Dr. Doug English from Australia seems to know what he's talking about.
You're doing fine, honey. You're doing fine.
Dr.